I'm Dr. Shiv Gautam. I'm Director Professor at the Gautam Hospital and Institute of Behavioral Sciences, Jaipur. And I'm so happy that tomorrow the entire world is celebrating World Mental Health Day. The theme for World Mental Health Day this year is Mental Health for All. Greater investment, greater access. Why mental health? What kind of investment and who should have the access? These are the issues which we have to deal with when we talk of the theme of the World Mental Health Day tomorrow. Now, if you look at the mental health data, the World Health Organization estimate is that more than 15% people suffer from mental disorders in the world. And out of them, about 8.5% people are such who are in urgent need of treatment by mental health care organizations. Are we equipped? That is another question. Second thing, if we take the disability due to mental illness in terms of disability adjusted life years, the disability due to mental illness is almost 25% of the total disability caused by any disease world over. So, there is a need for greater investment. Now, investment means all the governments of the different countries, all the governments of different states, if we talk of India, they have the onus of investing more on mental health. As such, the budget for health is small in India, and out of which mental health is probably on a low priority, if you look at the data. So what do? It is necessary for the policy makers, for the people who are involved in the health of the country, that they look at the mental health. Mental health is more important than physical health. Mental health gives value to life. If you are suffering from a physical disease, your mental health gets disrupted. Because of the disease, you are anxious, depressed, and so on. But if you are physically healthy, you have no diabetes, you have no hypertension, you don't have a cardiac illness, and your muscles are all right. But if you have mental illness, then you are not able to enjoy that health. In other words, mental health gives value to life. Therefore, I would urge upon most governments to invest more on mental health. Now, if you look at the awareness in the country, see, the stigma-ridden countries are there. And stigma due to mental illness is there in all countries for that matter. But stigma of mental health is more so in India. And to remove that stigma, we have to work hard and we have to help people to consider that mental illness is like any other illness. Some people are stigma-ridden because treatment for mental disorders goes long. But for them, I can tell you, how long do you have to treat diabetics? How long do you have to treat hypertensives? How long do you have to treat a person recovered from a serious cardiac problem? How long do you have to treat dementias, epilepsy, chronic back pain, and all debilitating physical disorders? If you compare mental illness with them, for example, depression, the treatment is not that long. The treatment for mental disorders lasts for 6 months to 1 year in the first episode. Even schizophrenia, which is considered to be a grave mental disorder, first episode of schizophrenia gets well in 3 to 6 months' time, and in about a year's time, if first episode is treated well, the relapse rate is far more less. Therefore, investment in mental disorders gives value to life. Then if the people who are suffering from chronic physical disorders, for example, in one of our studies, we compared the burden of disease due to mental illness and burden of disease due to respiratory disorders, COPD. We also compared with cancer, and we found that the burden of mental disorders is more as compared to burden due to cancer or burden due to chronic obstructive pulmonary diseases. Because in those diseases, it is one person who suffers. But in mental disorders, because of the disruption in the behavior of the patient, the entire family suffers. The wages of the family, various family members earn, that suffers. Economy of the family goes down, and the burden is far more due to mental disorders as compared to physical disorders. Then the question is, who are the people who should have access? Why should we invest? I have made a reason for it. But who are the people who need access? Access is people who are have-nots. People who don't have access to healthcare. And access to mental health care is far more less because the availability of trained mental health professionals in the country is much less. If you look at the total number of psychiatrists in the country, it is almost 7 to 8,000 for a population of 125 crores, 1,250 billion people. And if you take the statistics of all kind of mental health professionals, including clinical psychologists, psychiatric social workers, psychiatric nurses, even then the number is far less. I always say, leave aside treating them. If all psychiatrists decide to take even a glimpse, even the darshan of all their patients, it will be impossible to complete it in a couple of days. That is the state of morbidity. With such a huge morbidity, the access to mental health care is far more less to the needy people. So what do? We have to train our general practitioners. We have to train our healthcare professionals. Our national mental health program, as it was envisaged when we started it long back, I was present in the meeting in 1982. When the national mental health program was drafted, I was a young scientist who participated. But 2020, from 1982 to 2020, it is almost 38 years now. How far the National Mental Health Program has gone on, we must periodically review. We have not been able to reach the people who are really unreached. So what do? We have to create access to people even in the urban areas through our urban health programs. All general hospitals have to have trained mental health professionals. A good liaison psychiatry has to be established. We have to take care in the urban slums of people who don't even know that this disease is a mental disease. We have to take care of the people who are in rural areas, who are still spending a lot of time, energy and money in the temples of faith healing. We have to enrich them. And when we look at the human rights of mentally ill people, the latest law, the Mental Health Care Act, has given elaborate protection to the human rights of mentally ill. But that has been only in the teaching, in the institutions of established mental health care. But nothing has been done so far for people who are suffering in the want of access to mental health care in the community. So what I urge upon, that investment has to be, of course, financial investment, but at the same time, investment has to be in the conventional media, the print media and the television. All government programs should include mental health component, because mental health is not one person's business, it is everybody's business. Industries, they have to include mental health care for their workers. Educational system should give sufficient knowledge to our young boys and girls on mental health. We have crowdsourcing. We are a country, let aside the condition at the moment because of the corona, people are not going out. But India is a country where you have lots of fairs, lot of crowds, lot of people get together, have fun, except the COVID situation which is at present. And I am talking to you online. So those crowds have also to be sourced with, and they should have access. We must create awareness in the communities that mental health is treatable. Mental illness is treatable. Mental health is possible. This message has to go. We have a lot of responsibility as far as internet and media is concerned. As far as social media is concerned, they have a lot of responsibility to let people know about depression, about schizophrenia, about anxiety, about various mental disorders which are disrupting lives of people. People get sick, don't get treatment. I always say early treatment, early recognition, early treatment, prevention of disability. If we recognize mental illness early, maybe in doctor's clinic we identify depression, maybe in general hospital OPD we identify mental disorders along with the physical disorders as a comorbidity. Early treatment, when we start, we can prevent disability caused due to mental illness, and that is where we need access to people. So mental health situation in India, it demands active policy intervention, it demands resource allocation, it demands from the government. And to reduce the stigma around mental illness, we have to create awareness regarding mental illness. Many celebrities have, I would not name them here, They have come forward and said that we suffered from depression and we are all right. All people who suffer from depression or any other mental illness, when they recover, they should not hide their illness, and on the contrary, they should tell people. And last word, I would like to talk about suicide. Every 40 seconds, somebody in the country or in the world is ending his or her life every 40 seconds. That is the state of affairs. India is supposed to be a country where you have large suicidal rates, large rates of depression, and we have to do something about it. We have to start suicide prevention programs. Government of India should have a clear outline, invite experts to plan these, and I am sure a day will come. Through the Mental Health Foundation Jaipur, we are doing a small thing which is our contribution to the society. I have personally reached by now more than 50,000 adolescents to give them awareness about mental health programs through Mental Health Foundation Jaipur. We have to reach masses through the electronic media, and I am grateful to Forbes magazine that they have taken this year mental health as an important theme for their supplement. And I am sure whatever little thoughts I have shared with you will go through this magazine and create awareness to people who matter. Readership of Forbes is readership of people who matter. Therefore, through your magazine, we will reach to policymakers and other people, and I am sure that will serve the purpose of Mental Health Day tomorrow, 10th of October 2020. Thank you.